First thing, let me introduce my guest to talk about patient advocacy. Her name is Angie Tyree. Angie is a registered nurse. She represents no hospital today or any group. She is employed locally, but it is important that she doesn't represent any of those groups. So why is she here? Well, she's a friend of mine. And over the last, I don't know, have I known you 20 years, Angie?
I'm afraid so, yes.
Oh my gosh. We've had various conversations, and we've certainly talked about patient advocacy. That's why Angie's here to talk about this. She has some really, I think, good and important things to say. So here, let's start out with, so something is wrong with me, for example, me, and I go to the hospital, I go to the doctor, or I go to the hospital. And I might be getting some, very difficult news. I mean, do I need an advocate?
Yes, you do.
I do?
You absolutely do. Yes.
Why do I?
Well, because especially when you are admitted into the hospital environment, you're probably not feeling well. You're probably not at your best to think things through. You're probably shocked and just not in a good state of mind to make really serious decisions. And basically, people are going to be telling you what they're going to be doing to you, and you may not even think of questions to ask, or what those tests mean, or what am I looking at. And so if you have an extra set of ears and an extra set of eyes to kind of take in that information, it's just better. It's just better.
So does and I'm going to pick that person.
Yes,
it's probably going to be a family member or somebody who's
You
like
trust.
a friend, really important to me. Do they have to have any medical background?
No, they don't. I would say it's probably better to have someone who knows you pretty well, so they can tell if you are actually intaking the information that's being given to you. Someone who will know what you won't ask, maybe. We all have different ways of processing information, so it's kind of nice to know if you shut down when you're confused, or do you not focus on, like you kind of distract yourself. So it's kind of nice if somebody knows that about you and can kind of maybe focus you in a little bit better, or know when to take the reins, know when you need to vent or talk through a situation better. So it's kind of, I think it's best if it's someone that knows you. I know that I've stepped in for my parents, and it's not necessarily something that is, they have to be older. I think even if I went into a hospital situation, I would want an extra person with me, and I am in the system. So just because I don't think well, I do think well stressed, but let me rephrase. I do think well stressed because that's my job.
Yes. But you're thinking about other people.
Exactly. For myself, I would not think to advocate for myself just because I'm so used to doing it for somebody else. So I would need somebody probably just to be there to make sure I heard everything the way I needed to hear it.
Yeah. Well, is it important maybe that those people take notes?
Oh, yeah.
Taking notes.
Yeah.
Actually write it down.
Absolutely, because I was thinking about this driving home, and when you're given new information, you don't learn everything you need to learn in school on the first day. It's spread out over a period of time, and you take notes, and so you can recall what they've said, so you know that you asked the question and it was answered. I take notes all the time for myself, and I have them posted all over my computer because it's a lot of you have a lot of information coming at you, and it's and writing that note might prompt a question.
So it's better for you, the patient, to be listening to the doctor or the nurse and responding to what they might be asking you, and then the advocate over there on the other side of the room is jotting down the notes.
Yes.
Okay. All right. Well, does having an advocate mean that you think the hospitals are bad, or maybe they're not looking out for your best interests?
No, I don't think it means that at all. I think it means you have someone looking out for your best interest. I think that hospitals are run by people, and people do the best job they can because they are in that field for a reason.
Yeah.
But they're people, and sometimes they don't think that patient may have that question, or that patient may need that information right then and there. So it's always good to have someone else with you, just listening and questioning, like Like, why am I getting this medication? You know, one time I walked into my mom's room and she had knee replacement surgery, and it went fine. And I walk in and she's got blood hanging. She's getting a transfusion, and I'm like, whoa, why are you getting blood? And she's like, I don't know. They just gave me blood.
Okay.
I'm like,
Yes, yes,
that's
okay.
kind of serious. So let's talk to the nurse. You know, so a lot of people just do what people tell them and don't ever ask why.
So another set of ears and set of eyes. What is what are good characteristics? So if I'm picking out that person to be my advocate, coming along with me, you know, they should have certain kinds of qualities,
They
not
should.
just be a fun friend.
Fun friends are good,
Yes.
but you should have somebody who you trust, somebody who is curious. I think would be a good quality to have. That they're going to ask questions. I think someone who is vested in you is also, you know, important. I know there are some groups that you can pay an advocate. I know that that's out there. I don't necessarily know if, you know, you're their best interest necessarily. I mean, they're probably doing it because they believe in patient advocacy, but I want someone who kind of knows me, and if something happens to me, they're gonna, you know, question why and what's going on, and
Yeah.
they'll stick up for me if I maybe can't talk for myself.
So what is a patient advocate not? I mean, they don't have any legal authority whatsoever.
No, they are not going to dictate your care. They are not going to make any decisions for you. They are not allowed to make any decisions for you. I think the best thing, if you are going to have somebody who is going to be with you at appointments and with you at the hospital, they need to be included for information, and there will be a form for you to fill out that it's okay to give them information. Let's say,
Oh, I see. Yes.
yeah, let's say that you go home from the hospital, and let's say what the nurse or doctor told you your medication was going to be. Let's say take it 3 times a day, and you get the pill bottle and it says take twice daily, and you don't feel well enough to talk on the phone. That person can call and ask, but if they're not on that form, they will
I
not
see.
get any information.
Oh.
So
okay.
you have to make sure that that person who's going to be with you is able to receive information about you. And so I know that I have my parents signed so I can call their doctors at any time and ask any question and receive information.
All
And my
right.
brother too, actually, for that matter.
Yeah. We're going to take a break here, but when we come back, we're going to ask Angie more questions about being a patient advocate. If you've got questions, you want to join our conversation, 547-8726. We are back in a moment here on Meet in the Middle. Welcome back to Meet in the Middle on this Wednesday. It is the 23rd of December, and I'm talking with Angie Tyree. She is a registered nurse, board certified, she lets me know as well.
Yes, absolutely.
And has worked in a variety of situations, from hospitals to
Private practice.
private practice, and so has, I think, a broad range of some experiences. So give me a couple of examples, if you don't mind. Of course, no names or of the living or the dead,
Dang it.
of situations where you have observed, oh my, that person really needed someone to be there to listen for them. Can you think of anything?
How long is this show?
Come on.
Well, I had one patient who had a cancerous tumor in her lung, and it was not responding to treatment. And she was admitted to have a PEG tube placed, which is a feeding tube, because radiation had burned her esophagus, and so she couldn't swallow. But treatment wasn't going as well. It wasn't going. And she was basically going to die of this tumor, but no one had explained that to her. And here she was about to have an invasive procedure to prolong basically suffering. And I had to figure out how to talk to her because she didn't know that was what was happening. And so I just asked her, you know, what were her plans if things, you know, weren't going, you know, what was her thought for the future, you know, and what did she want? and she said that she wanted to be with her family and that she wanted to be comfortable. And I said, you know, that those are really important things, and I'm glad I'm glad we're having this conversation. You know, do you know what that looks like? You know, what does comfortable mean to you? Because you're about to have a surgical procedure where they're going to put you asleep and, you know, make a cut, and you're going to have to heal. And she said, oh, no one explained it to her. She didn't understand what was happening. And so we had a conversation, and so we actually got hospice involved, much to the dismay of the surgeon. And she decided that's not what she wanted. And in the end, that's not how she wanted to be. Unable to enjoy meals with her family and celebrate with her family. And so she decided against it, and she wanted a hospice consult, which was really hard because I felt badly, but no one had asked her what she wanted. And so she hadn't even thought to tell somebody what she wanted. So it was important. I think it's important that you understand what your treatment looks like down the road.
Yeah. So oftentimes then your advocate can go outside the room.
Oh yeah.
And talk with other personnel there at a hospital setting or a treatment setting or whatever, and get some information, maybe not asking those questions in front of you, but finding out the information and then determining the best way to share it.
Well, and your nurse could be your advocate. I mean, if you're like in private practice, you know, the person who is answering your triage call, the person who is looking at all of your prescription and your lab work, you know, you can simply say, you know, can you please let me know when I need to have someone else involved? You know,
oh, okay.
You know what I'm saying? So if you come to your appointment and everything's fine, you're just doing routine labs and blah, blah, blah. But, you know, you can say to that nurse, okay, when things are different or when my labs don't make sense to me, are you willing to be that voice for me with my provider? Because really, when you have a 10-minute follow-up visit scheduled with a provider, I don't know who can get all the information they need in 10 minutes. How long is your show? I mean, like, and so it's important that you use that time as best you can. And so a lot of times that means you're writing questions down before you walk in the door. So you make sure they get answered, because someone walks in a white coat, I get flustered with a white coat even.
Yes.
So, so it's important. Yeah, that person, you can be anybody, you know. Your advocate can be anybody.
That was an interesting example. How about one that isn't so life-threatening? Okay.
Okay, so I had a patient whose therapy was expensive, and didn't know that there were foundations out there to help her pay for her medication, that there was copay assistance. So it was. So it's part of knowing the system, you know. So that's why I said a nurse can be your advocate in that in that private practice, because they know the ins and outs, and also, you know, just to get prescriptions, you know, approved or prior authorization from the insurance company is a horrible hoop to have to jump through. So sometimes it's nice to have someone who will be on the phone with your insurance company for 44 minutes because that's what you need.
Yeah.
So so that's another one, you know. Using the resources that my mom and dad didn't even know that they could get foundation assistance for their medications. So it's like, you know, if you talk to your provider about A, samples, or B, foundations, and they're like, no. Those are good questions to ask. But they didn't know to ask the question.
You can, as the patient, can be asking those questions,
right,
or your advocate. So you mentioned the whole thing about research. So your advocate can do some of the research for you about what an illness is or what a disease is, and provide you that information.
I would say go to a reputable website if you're going to do Dr. Google. I mean, I would say.
What's reputable in
I would
your
say
opinion?
like Mayo Clinic, Cleveland Clinic.
Okay.
You know, WebMD is not necessarily the best source to go to.
But it would be your recommendation of Mayo Clinic.
Yeah, I would. Okay. I that's what I go
that's
to.
That's what you go to.
It's,
okay.
It's a good language to. I mean, it's written very cleanly and plainly. Also, sometimes if you have like a specific disease process, like leukemia or rheumatoid arthritis, you can always go to that disease website.
Mm-hmm.
If you have, cardiac issues, American Heart Association, a lot of times if you go that route, they'll have other reputable resources on their site to access for more information. And I am a firm believer in the more education you have, the better choices you can make for yourself.
Yeah, absolutely. It seems to me that when you are being discharged,
Mm-hmm.
that is like a really important time to have an advocate there
Yes.
to get all that information. You're getting descriptions of what you're supposed to be doing.
Yes. Yes.
When you're not going to be supervised by medical people anymore.
Right.
Yeah.
Right. We're not being
So,
taken care of.
Yeah. So you better have that person there with you then.
Yeah, because I'm not gonna say that, because you're leaving a place of established care
Yes.
to suddenly do it by yourself. And nowadays, you can't get admitted until you're sicker than you used to be. And you're going home sicker than you're not well when you leave the hospital
Right.
generally. So
Mhm.
you're just better enough that they can send you home.
Mm-hmm.
And so you're probably still fatigued, which means you're not thinking clearly. You're probably, and the idea of taking care of yourself might be stressful, so you're clouded by that, and so it's important you have someone there to support you and to help you get through the paperwork of a hospital discharge. Sometimes they're 13 pages long.
Whoa, okay. The other thing I was just thinking about is that you may not have just one family friend or relative that is playing this role of advocacy. So that is another reason why I think taking notes becomes important. That you can pass it on
Yes.
to the next person. They can go back and look at this stuff before that's been said that they've written down the notes for.
Right, and so actually even in the hospital setting, we hand off to the oncoming nursing staff
Right.
for that night. So it's the same thing. And also I think also helpful to have an advocate is that they have like a, what we call a phone tree, a list of relatives. So you as a patient aren't repeating your story or what happened, 3, 4, 5, 6 times. Because like telephone tree, when you play telephone, that story gets shorter and shorter and shorter. And so
Mhm.
maybe some of your relatives aren't getting all the information they need to help you. Like,
Mhm.
like maybe you need to limit your visiting time because it's exhausting, or you need someone to help get you medication. Maybe someone lives closer to the drugstore than the other person, or so sometimes an advocate is really just someone that passes off all the information you need to the people you love.
Yeah, all right. So, is there anything that we haven't talked about right now that has to do with being a patient advocate or having one that you think is super important that people hear?
Gosh, that's a really good question. I would say, I would say, you can always, I got really good information from the AARP website about a patient advocate.
Oh, okay.
Yeah, and so, because I was looking for, I have this information in my head. Is there information out there for other people? And so AARP had a really good article and things to look for, what makes a good advocate. And, but I think we hit all the good stuff.
Good. AARP. I
Mhm.
think that sounds like a good option. So if people are doing any surgeries or
Or
any
even
other
just
kinds of
navigating
things,
your insurance.
There
swear,
you go.
I swear to goodness, that's enough to bring someone into the doctor's office.
Angie Tyree, I just really enjoy that you are my friend.
I enjoy that you're my friend.
You have all this information to share, so thanks for coming in today. I
Thank
appreciate
you for having
it.
me.
Yeah. We'll be back in just a moment here on Meet in the Middle. Stay with us.